In terms of, for instance, nutrition is going to be very important for patients to heal that incision. And for them to have like eat good folic acid, to have like all their vitamin supplements, to have their good amount of protein, because they're going to need a lot of protein to like they need blocks to be able to repair that wall that we're going to be repairing, right? So that's really important. Habits, as you can imagine, smoking, it affects wound healing or nicotine use in general, affects that. In terms of, there are other things that we cannot control, but the fairer the skin, the better the healing. The darker the skin, the healing tends to be a little bit more aggressive. Another thing that we cannot control is the younger the person, the healing is going to be a little bit more vigorous. And the older the person, the healing is going to be a little bit more mellow. We have a comprehensive scar therapy that we provide for patients. We use products from Elastin, depending on the surgeon. But I know that there's quite an advantage of starting the care of the area with the Elastin products before the fact that you go and undergo surgery. And then it's very important for an incision to have, for the first 24, 48 hours, an environment with a good amount of like moisture that promotes healing of the epithelium, meaning of the top layer. So that's for the first days. And you'll see that all of us, all the surgeons uniformly say we put some dressings and we leave those dressings on. We see patients either the next day after surgery and a couple of days after. And then we tell them like, we're going to be leaving this on top because we want that incision to be pampered. Then at a week, we always want to make sure that there's no infection. We take a look at that and at those incisions. And most likely we're going to be either replacing or leaving some of those tapes on, or the dressings, or the Dermabond, or all these different paraphernalia that we use to cover those incisions. Then at about 2 to 3 weeks, and again, this depends a lot on the specific surgeon, we start with that scar therapy, scar massage, actively telling patients how to do it, when, how often, and depending on the different procedure, as you're saying, how they're going to be doing it. And then you start to see that scar at about 6 weeks, at about 3 months, and catching and seeing if the scar tries to heal more than what it's the right amount. So meaning if the scar starts to become a little raised, a little too exuberant, and then you can start intervening at those points. But that's, as you can see, as part of a process, and you want to go through that process in a close way and together with your patient.